Public health is an absolute priority for the EPP. One of the most important evidence of it is the European Plan on Beating Cancer, that we strongly want it and promote it since the beginning, as well as the new Special Committee on Beating Cancer, which proposal was firmly led by the EPP, and that will start working from next September. We at the EPP have always put health at the center of our actions, and we believe COVID-19 has given us a great opportunity to put health at the center of all policies and build a real Europe for health, successfully able to face future pandemics, demographic trends, and climate challenge, and achieve sustainable innovation, better access to treatment for all, effective prevention of chronic disease and cancer, competitive research, and digitalization of the health systems. In this second question, the pandemic has shown that disease knows no borders, and global threats cannot be fought with local response. To be resilient in public health emergency, the European Union needs more coordination between member states during a health crisis, more competence and capacity of taking decisions at European Union level to prepare for and fight health crisis, and more investment in health systems to make sure that they are ready for future challenge. We at the EPP welcome the standalone European Union Fourth Health Programme proposed by the Commission and are now negotiating amendments to make it better financed, more robust and ambitious, with the capacity to face any future pandemics and health threats. As I previously mentioned, we commit the group and ourselves to the absolute priority of fighting cancer, following the call of the Commission President, Dr. Ursula von der Leyen, also member of the EPP, for a European plan to fight cancer that will see the light next September. Last but not least, to redesign the path for a future European Union for health at the center of the recovery plan, we at the EPP have been leading the process to present a joint motion for resolution on the European Union post-COVID-19 health strategy that will be voted by the Parliament in this plenary session. This is how we put our knowledge, experience, and influence at the service of the European public health for the wealth of all the European citizens, without leaving no one behind. Social networks are the best platform for connecting with the citizens and transmitting what we have achieved or what we are working on. When we talk about the European challenge of moving from the analog for the digital era, it is also important that we as politicians do it with the communication tools and not only the companies and the citizens as a whole. The presence in the social networks is not only a way to communicate, but also to bring the institutions, in this case the European ones, closer to all the European citizens. And we can do it with a diversity of options and platforms, videos, image, computer graphics, live broadcast. And we use each social network in a different way. Like more political is Twitter, for example, and a more personal and close profile is Instagram. Social networks are not only the future, they are also the present. These four questions, I believe that they go hand in hand. If there is no political influence, there will be no social influence. In the end, every work that we do and that we achieve through consensus, dialogue, and joint efforts, the citizens end up seeing it and appreciating it, as has happened with the European Recovery Plan. We have worked intensely and tirelessly, and we have communicated this in the media and social networks. That political leadership we can have is also reflected in the leadership for society. And this is what the People's Party is doing with each of the measures it is implementing, walking our talk.